Orealla, a riverine indigenous community, is located just over 50 miles off the quarantine coast and has a population of approximately 1,200 persons. Siparuta is nearby with a population of 450 persons. Together, the health needs of these two villages may vary, which means residents are forced to travel great distances to access specialized healthcare services along the coast. Persons from as young as a few months old to the senior citizen in the area made a special effort to turn out and access the services brought to them free of cost.
It is very beneficial because it's due to the poverty. People don't have money to really pay for these things out on the coast. So it is a very valuable services. So it should be done regularly.
Right now, for a week now, I was ill, a terrible cold and pain in my body, in my joints and so forth. And I was just deciding to catch a boat to go to Corverton to see a doctor or someone. And that would cost mainly about $25,000. So I'm very thankful for this outreach. It helped me a lot.
I really appreciate this outreach because plenty people that's sick, they're not able to go to Orealla because it's really hard. Sometimes we don't have a boat, and for fetch some of them you got fetch them, they don't walk, and we're really happy that this must always happen. Anytime you come to Orealla, please come to Siparuta.
Director of the Ministry of Public Health Regional and Clinical Service, Dr. SHAKO, spearheaded the team to the two villages. Dr. SHAKO expressed that the ministry's vision is for Guyanese to be among the healthiest in the Caribbean. Exercises such as these sets out to capture those lagging behind with poor health and to ensure that they are properly treated and diagnosed as necessary.
Also, our mandate at Regional Health Services is to ensure that health care is appropriate and adequate across all 10 regions. But listening to our scope, you will understand that it's not easy. It can be challenging at times. That is why the Ministry of Public Health would have deliberated and said, okay, in order for us to meet our goals, well, then we have to do outreaches, especially in those areas that are remote.
In January last, two similar teams were deployed to Waipa and Carisparu in Region 8. Specialists are scheduled to be a part of outreach teams to Camarang, Lima Sands, and other far-flung communities shortly. From the village of Orealla on the Quarantine River with videographer Anil Silal, I am DELICIA HAYNES for InfoHub.